I gotta make sure that you can hear me. And before I do that, I want to fix that. There you go. All right, so I'm looking to see if you can hear me. All right, someone said my mic sounds nice. Check one. Hello, hello, hello to my team, Mr. Sandeep, Ms. Mills, Miss Beth, Miss, I'm not sure, I haven't seen Miss Haley. If she comes through, hello, hello, hello. Hello to the interns. I see Vina D. I see Miss Beth. Um, all right. So I think that's who's here. And if you come through, I'll acknowledge you. All right. So it looks a little different on the screen. You can see the chat. I will be removing that so that we can take advantage. Thank you, Mr. Sandeep. And let's get started. Oh, let me shout you all out too. I see. I don't know if you are new or not. Patty B, afternoon to you. Hello, Mojin Rena. I know I'm not saying that right, but you know what I'm trying to say. If you could spell out phonetically. Hi, Tane. Hello, Lynn. Hello, Lucky. Hello, let's see. Anne. Welcome, welcome, welcome. I'll get to everyone else. And welcome to our new members. Glad to have you here. All right, let's get started. Hi, Kimmy. All right, we might go over just a little bit, but if you have to go, I understand. Hi, Pawan. All right, so I got a poll. If you were here last week, this is applicable to last week, but it can be applicable in any regard. Okay, coders, how comfortable are you with coding modifiers 22, 52, and 53? A, I'm confident. B, I'm okay. C, so so. D, I need help. Or E, what are modifiers? Go ahead, put your answers in the chat. There's no right or wrong answer. Okay, okay. Hi, Sherry. Welcome. Welcome, Vermont Mom. All right. Some people are like, hey, I'm confident. That's what I'm talking about. Walaka, welcome back. Juanita, Goodwill, Tane. All right. Obviously, so they're new. Hey, welcome. Welcome, Chanda. And I know someone's going to tell you that I try to pronounce names and I mess them up, but I know these are your screen names. So please don't be too tough on me. Hi, Linda Gates, Uma. Good to see you, Deborah will be. Okay, good. So thank you so much for your participation in the chat. That just lets me know, you know, how you are. And I do know that I recognize some of those A's. I recognize you from last time. Some of you, not all of you. And so if you kind of know them on your own, way to go. All right, so how well do you recall? How well do you recall what you've learned last time about modifiers 22, 52, and 53? Let's go. True or false? A surgeon performs an exploratory laparotomy and documents the patient was obese and had moderate abdominal adhesions. It would be appropriate to append modifier 22 because the procedure was more difficult than normal. What say you? Is it true or false? Put your answers in the chat. Thank you, Ms. Mills. Yeah, this was a tough one. Some people are like, I don't know. I don't know. I don't know. I'll wait a few more moments for a few more people. And the answer is false. It's false because based on this documentation, we don't know. All we know is that the patient was obese and had moderate abdominal adhesions. When we use that modifier 22, it has to be some extreme circumstance, Extreme. What's more extreme than obese, right? Moderate is not extreme. Extensive. We're looking for those keywords. All right? So just let that marinate a moment, okay? Now, let's go on to the next one. A physician plans a complete exploratory laparotomy, but after identifying the source of pathology in the stomach, intentionally limits the exploration because further examination is no longer medically necessary. Modifier 22 may be appropriate. True or false? What say you? So the doctor went in, supposed to do a complete laparotomy, but didn't. Just did maybe a portion or a limited laparotomy. Can he use modifier 52? And the answer is true. Absolutely. Yes, for the very reasons. He did not complete the full procedure. It was limited. Next question. Very good, everybody. Very good. A procedure was initiated under anesthesia, but severe arrhythmias developed before the procedure begins, forcing the physician to cancel the procedure for patient safety. Modifier 53 would be appropriate, true or false. What say you? Go ahead, put your answers in the chat. And for those of you that are new, you can find your modifiers in the front cover of your CPT manual. The definitions, the abbreviated definitions are there. But if you need to read it, it's in the back in Appendix A. Yes, go to Appendix A to read it. All right. So overwhelmingly, oh, some people said false. That's okay. Good job. Goodwill, because the answer is false. Why is it false? It's false because no procedure took place. If there's no surgery, then there's no code. I'm going to let that marinate. I know, Chrissy. Aha! I love it. I love it. And again, I just want to remind everyone there's no judgment here. No. Do you know the errors that I make, instructors, other instructors, we make errors all the time. That's why we have our team back us up because you can easily overlook something, right? And remember, we were where you were. Hello, Miss Haley. Great seeing you. Okay. A physician documents that a procedure required an additional 15 minutes due to unexpected bleeding. Append modifier 22 would be supported. True or false? Someone saying preparation was started. That was the anesthesiologist. The anesthesiologist can code, but not the surgeon. Surgeon didn't do his part. Good point, Aviva. All right. Again, what we have to gauge and tell ourselves was extreme. Extreme. That's your key word. Extensive. So this answer is false, right? Only extreme words. You got to look for those extreme words. Okay? So, an additional 15 minutes due to unexpected bleeding, I would say extensive bleeding. Okay? Unusual. All right, let's get in the habit of looking for those keywords. 15 minutes. This modifier 22 gives them a lot more money, just to let you know. Okay. A surgeon performs an exploratory laparotomy and documents that the patient was morbidly obese and had extensive abdominal adhesions. It would be appropriate to append modifier 22 because the procedure was more difficult than normal. True or false? What say you? No, you're not, Deborah. Deborah, you got this. Look, you got this. I promise. All right, I see you, Kimmy. Okay, Patty B. Okay, Mina. Let's go. What is your answer, true or false? Hi, Goodwill. There you go. Okay, Katie did. That's right, Shantae. Good job, everyone. Good job putting those answers in the chat. And when I'm commending you on answering, not what you're answering, if you're new here. All right, the answer is true. What was extreme? Extreme, morbidly obese. Morbidly is the extreme version of obese, and extensive abdominal adhesions. That is extreme. All right. All right. Good job, everyone. Good job. All right. I believe this is the last one. A surgeon begins a laparoscopic cholecystectomy and inserts the laparoscope into the abdominal cavity. Shortly thereafter, the patient develops a life threatening cardiac arrhythmia. The surgeon terminates the procedure immediately in the patient's best interest. It would be appropriate to append modifier 53 due to the procedure code. I mean, modify 53 to the procedure code. True or false? What say you? Now, these are, these scenarios were a little tough because, the goal last week was mastery, right? Yeah. And look at you all. Look at you all. Just blaze it. And I know you're all like, yeah, do it again, Mrs. J, because the answer is true. Yes, this surgeon had already engaged the procedure and stopped it, right? Boom, modifier 53. Surgery started. All right, so what do modifiers usually do? Well, we learned last time that modifiers do one of three things. They either, number one, increase the payment, number two, decrease the payment, or number three, it's just information. It gives more context to the story. And you know what? Modifiers also have to be sequenced properly. So you're supposed to append as many modifiers that are applicable, but you need to append that functional modifier before the informational modifier. Functional modifiers impact the money. Informational modifiers just give you information. So whether the money is going up or down, they go before the information. Function goes first. All right. That's right, Ms. Vina. I love the participation. I also love the encouragement that you all are giving in the chat. So, round of applause to everyone. Okay, now we're going to begin our discussion. This week, we're going to talk about modifiers 50, 51, and 59. And these modifiers are appended when there are multiple procedures in one encounter. Now, I just want to know how many of you feel comfortable with modifiers 50, 51, and 59? Look, Panwa's giving the team shout outs. I love it. I love it. Okay. How many of you feel good about these modifiers 50, 51, and 59? All right, so I guess you don't have to say you do. If you don't answer, I'm going to assume that hey, maybe not. Okay? It's okay. All right, so I want to tell you this. I want to give you this scenario, and maybe this will help us. It's context for learning modifiers 51, 50, and 59. Well, we have this case. We're in court. In fact, you all are the jury. You need to be the jury, right? I'll be the judge. You can be the jury. All right. So We got Mrs. Thompson versus Mr. Joe Fixit. And this is a case of the missing $3,000. Well, Mr. Joe had a fence staining project that Mrs. Thompson hired him for, right? So Mr. Joe Fixit said, "Hey, you owe me $3,000 because I completed the job." And Mrs. Thompson said, "Hey, I am not going to pay you any more because I've paid you the full amount. Now, it is my job and your job to determine if Mr. Joe Fixit is entitled to any more money." All right. So good will say, I'm comfortable with 50. After all, hopefully after this discussion, you all will be comfortable, more comfortable with 50, 51, and 59. All right. So we know the dispute. The dispute is $3,000. Now we need to get to the bottom of it. And the plaintiff, Mr. Joe, says, "Hey, the price is $1,000 per fence. And the defendant only paid him for one fence. And he stained a total of four fences." And the defendant, Mrs. Thompson, says, "Hey, that she only has one fence. So she's only got one fence. So what am I doing paying you for four?" Welcome to our new member. Okay, so that's the problem. Now we're ready for the evidence. Here is the evidence. All right, so the plaintiff, Mr. Fixit, said, "Hey, there are four fences in your backyard. You've got your back right, you have your back left, and you have your rear fence in the back, and in the front, you've got a front fence. That's four fences, $1,000 each." And Mrs. Thompson, she's sticking to her gun. She said, "Hey, that's one fence around my house. I have one fence going around my house. So we got a problem." And Miss Thompson even doubled down and said, "Hey, fence staining is fence staining. You stained one fence." Okay. Now it's my realization. All right, so she has a point that there is one but one property, but is it one fence? Now, you, jury, you need to determine if it's one fence, right? It's your turn. But before you do that, I want to give you some tools, right? Let's talk about modifier 50. We're going to deviate away from the case. And we're going to talk about modifiers 50, 51, and 59. And this discussion may be able to help us determine if it's one fence or more than one fence. And remember what modifiers do. Modifiers either are going to increase that payment, it's going to decrease the payment, or it's going to give you more context for the story. But in this case, it's going to affect the money because modifiers 50, 51, and 59, they are functional modifiers. They do impact the payment. Now, when you have um, multiple procedures, meaning there's more than one procedure that takes place, you may need to append a modifier. Not maybe, but you will have to append a modifier if it's not an add-on code or it's not built into the code. You more than likely will need a modifier because of these facts. Fact number one: insurance systems or payers, they're designed to pay for one procedure during an encounter, right? One procedure during an encounter. So if a doctor carries out 50, like excises 50 lesions off of a body, that insurance system is designed to only pay for one of those lesions, and that's across the board. And if you always remember that, that might help. Number two, if no modifier is appended, then no payment for subsequent procedures will take place. Number three, only one code gets paid, but a modifier will modify the condition. I'm really saying the same thing, but I'm really, really trying to drive it home. And insurance payouts are typically when you append modifier 50, you get up to 100% of the allowed amount. It depends upon the plan. You might get um, for that procedure, you'll get 100% for the first procedure. So maybe this should say 150%. So 150% of the allowed amount for modifier 50. In other words, you'll get paid for the full for the full one, and sometimes you'll get paid full for the second, or 50% or 100%. I don't know. So we're going to leave this at 100% of the allowed amount, okay, just to kind of make it even. But putting that modifier 50 pays for the other side. So you're going to get more than you typically would if you didn't put that modifier 50 on it. So if you just put that one code, you're only going to get paid for one. Put modifier 50, you're going to get paid for two. Now modifier 51. This typically pays 50% of the allowed amount. Most people don't want to put modifier 51 on that next procedure. They don't, because you only get half. Now, modifier 59, you get up to 100% of the allowed amount. So a lot of people want to use modifier 59. A lot. A lot. And we're going to talk about why they do. Now, we're just going to look at each one individually. Let's look at modifier 51. I want to start with modifier 51 because this is, I think, this is going to be an aha moment for a lot of people. Modifier 51 is the default multiple procedure modifier. If you have multiple procedures, you should always look at modifier 51 first. That's the default, right? Did the provider perform more than one procedure during the same session? If you say yes, then it's probably modifier 51. Now, a doctor can perform skin lesions, repair lacerations. Like if there's a lesion, then he repairs it. That might be modifier 51, the repair. And then you've got keywords like multiple procedures, additional procedure, etc. Now, don't use modifier 51 with an add-on code. You cannot append modifier 51 with an add-on code. Now, let's take a look at our example to the right, procedure 1. They excised the skin lesion. Then procedure 2, the doctor repaired that excision. So they kind of go together. This one, or excuse me, the procedure, and this is for you, Miss Beth, the procedure that is most extensive will be what you code first. So I just got a question for you. If the doctor excised this lesion, then they carried out a layered closure. Like they closed, one layer, then they closed it and repaired the top layer. Which of the two was more extensive? Go ahead, type in the chat. So yes, someone said, can they get copies of this? Yes, you will be able to see the playback, and I'll show you how to get it at the end. All right, everybody. This wasn't a part of the instruction, so I'm just going to tell you that the repair is going to be more extensive because it's going to take a little longer. Yeah. a layered repair, not a simple repair. In fact, you wouldn't even code a simple repair. It would be bundled. Yeah. So that 51 modifier would go on the excision. All right. Now, let's move on. And we're going to turn our attention to modifier 59. A 62-year-old patient presents for excuse me, I apologize. Please forgive me. We're not on 59. This is your application to practice, so I apologize. Of the following answers, which best describes the encounter? A, 43235, 45378, 51 modifier. B, 43235, 50 modifier, 45 45378. C, 43235, 45378, 59 modifier. And D, 43235, 45378, 52 modifier. A 62-year-old patient presents for evaluation of dysphagia and a history of colon polyps. During the same operative session, the physician performs an esophagogastroduodenoscopy and a diagnostic colonoscopy. Okay, coders, what say you? What is the answer? We got one answer in the chat. You know what? I think I messed this up. I did. This is not the scenario for this. Hmm. All right, so we have the same operative session. We have an EGD and we have a diagnostic colonoscopy. Ah, Mrs. J messed up. All right, so let's just go on through this. This does not belong with this, but let's keep going. All right, so the first is an EGD is a scope that views the esophagus, the stomach, and the duodenum, the upper part of the lower intestine. Whereas the colonoscopy, it views the large bowel, all of this. So those are two different procedures. So if they're different, why is this 51? This is not 51. This is 59. That's a huge blunder, huge, huge blunder. So we're going to continue. But I do want, it's a blunder on my part because I wasn't supposed to use this. But this is not 51. So yes, they are different procedures. So modifier 59 is not used for this. They're different body parts. Okay. And therefore we cannot code them. And how is this like this? I apologize. This is so wrong. This is modifier 59. Those are two different procedures. All right, so let's regroup. And I'm really talking to myself. 51 is used for multiple procedures, 59 for multiple different procedures. All right, so hopefully I didn't confuse you. Now we're going to get on over to modifier 50. This is bilateral. Okay, so before you say anything, just kind of let it play out a little bit, okay? Okay. All right, so I used the wrong example on the, the wrong example. So that should have shown you um, multiple procedures. All right, but I'm going to drive this home. Trust me on this one. All right, so when you have bilateral procedures, this is a multiple procedure as well. It's the same procedure on both sides of the body. In our case, we've got two carpal tunnel procedures, one on the left and one on the right. And when you have bilateral procedures happening at the same time, this might not be bilateral. This guy has 6 fingers. I'm just now seeing that and it happens at the same time, then you append this modifier 50, right? So it's kind of straightforward. Someone said, "Hey, I'm cool with modifier 50," and you should append that modifier on that procedure to show that two procedures took place. If you fail to put the modifier 50, you will only get paid for one. All right, here's our scenario, and hopefully this is the right one. Of the following answers, which best describes the encounter? A, 6698450 modifier, B, 6698451, C, 59 modifier, and D, 52 modifier. A 72-year-old patient with visually significant cataracts in both eyes presents for surgery. During the same operative session, the physician performs cataract extraction with intraocular lens implantation on the right and left eyes. What is your answer? I knew it. I knew it. Very good. All of you said A. Both eyes, right and left, were operated on. It's the same operative session, and they had a cataract extraction. Same exact procedure. So, yeah, this is modifier 50. Multiple procedures, same procedure on both sides of the body. Now this is, now we're going to move on to modifier 59. Now, the difference between modifier 51 is that's for a straight multiple procedures. When you have multiple procedures, it's modifier 51. All of them should be 51 until otherwise, and I'm going to explain. All right, so modifier 59 is for multiple procedures, but that subsequent procedure needs to be a different procedure. What does different mean? Well, we're going to talk about it. Well, here's an example of a different procedure. We have this patient had debridement wound on the left leg and debridement, same procedure, but on the right arm. So these are different procedures. All right. Now, some you have some keywords to help you distinguish what a different procedure is when you see language like separate lesion, separate site, separate incision, separate encounter, distinct procedure, different organ or different organ system. When you see that, it's different. Now, how do you know this is different, Mrs. J? Well, I know it's different because Appendix A is gold. It is absolute gold because the definition actually clarifies what distinct is. So if you go to Appendix A, read 59, distinct procedural service is modifier 59 is used to identify procedures or services other than E&M. So you don't use 59 on E&M codes that are not normally reported together, but are appropriate under the circumstances. Also, different session, different procedure or surgery, different site or organ system, separate incision or excision, separate lesion, huge, or separate injury. However, when another already established modifier is appropriate, it should be used rather than modifier 59 only if no more descriptive modifier is available and the use of modifier 59 best explains the circumstances should modifier 59 be used. And the reason they say that last sentence, modifier 59 is the most overutilized of the modifiers by providers. It is most because you get 100% payout. That's why. Now, I want to go back to the error that we had, like the slide that said the EGD and the colonoscopy was a multiple procedure as opposed to different. Well, this definition here will tell you that that's why it's different. It's a different procedure. How do you know it's different? Because one is called an EGD and the other is a colonoscopy. Does that make sense? Are you all with me? I'm kind of flying a little bit. Let me know. Or maybe my chat is slower. Very good, Mina. Thank you, Vina. Okay, so just to let you know, modifier 59 is the most overutilized modifier. So overutilized that Medicare came up with these other modifiers, XP, XS, XU, XE. We'll talk about those at some point later, but trust me, 59 is overutilized. All right, so we got a scenario. Of the following answers, which best describes the encounter? A, 11402, 1120051. B, 110, 11402, 50 modifier, 11200. C, 11402, 1120059. And D is modifier 52. A 60-year-old patient presents with a suspicious skin lesion on the left forearm and a symptomatic skin tag on the neck. During the same encounter, the physician excises the lesion on the left forearm and removes the skin tag from the neck. Documentation indicates the procedures were performed on separate lesions at separate anatomical sites. Okay, chat. He gave you a hint. What say you? All right, those answers are coming through. Hi, Concetta. Welcome to class. You all are doing an amazing job just having the courage to put the answer in. I'm definitely impressed. Hi, Francois. I remember you. Hi, Becky, Tiffany. Hi, Matthew, Shanta, DC Kicks. Okay. That's right. You got it, coders. And here are my modifier driven keywords. They removed one lesion and then they removed the skin tag. Two different entries. One is a lesion, one is a skin tag at the same encounter, but they carried out different procedures. To remove this lesion, just like common sense, to remove this lesion is going to require a different technique than to use that lesion, to remove that lesion. That's one difference, right? But you all are correct. The answer is C, modifier 59, because 59 means multiple procedures, but that subsequent is a different procedure, right? So remember, these different procedures is modifier 59. So if we put everything together, modifier 50, oh, good. He put his hands are back to normal. Means the same procedure on both sides of the body. Number modifier 51. This is the true multiple procedure. True multiple procedures code. So typically it's going to be modifier 51 unless otherwise. And we're going to talk a little more about this. And 59 is multiple distinct or different procedures. Now we got a big, huge, huge MJ gem. If you don't know what that is, this is a gem that I want to drop to help you kind of figure these out When you have multiple procedures, it's modifier 51 unless it's bilateral or different. I'm going to let that marinate. It's modifier 51 unless it's bilateral or different. You all with me? And don't forget these modifiers. They increase the payment. These they impact the payment. Modifiers 59 and 50 are going to increase the payment, and 51 it's going to decrease the payment of that second code, of that second procedure. All right, good. Now we're getting back to our multiple fences. So how do these modifiers help? Well, mainly our job is to determine if it's one fence or are they different fences, right? And our error that we had, I think, really drove it home for me because if it's a different procedure with a different name, then it's different, right? Right? If it's the same, it's going to have the same name and the same procedure code. But in our case, we need to know, is this one fence or are these different fences? Well, it looks like they all have different names. One is back right, one is back left, and I'm going to give it modifier 50 because he did the same exact procedure on both sides of the yard. And the rear fence is different. In fact, it even has a door on it. See the door? So that I'm going to give it modifier 51, multiple procedures. And when you think about it, this is the backyard. Now this front fence is in the front yard. It's in a different yard, different part of the yard. And it's a different type of yard, different type of fence, excuse me. So I think it qualifies for 59. You all with me? So the right side and the left side are exactly the same. He did this exact same stain job on the right and left sides. They're exactly the same length too. Same. That's a modifier 50. The back is another fence, right? And it's got a little door on it. It's not different, but you're in the same part of the yard. It's a different procedure. It's a different part of the yard, but I would code it 51, and I'm going to explain why. Because I wouldn't say it's in a different part of the yard. It's traditionally you would paint the back fence too, right? Now the front is different because it's a different type of fence, right? It's even in a different part of the yard. So I'm giving it modifier 59. Now, let's go ahead and let's solve this dispute. Well, Mrs. Thompson, I think the jury has to speak. Okay, jury, we need a conclusion. I need to know what you conclude. Is this the same fence as Miss Thompson alleges, or are they different fences as the handyman alleges? Go ahead, type in the chat. They're like, I'm not going to answer. There's no right or wrong answer. There really isn't. Even though I kind of swayed it, right? I kind of explained it. And if I did explain it and you think it's different, then you know what? Then I've done what I was supposed to do. So if you didn't know, these are different fences. And this Mr. Fix It stained all those different fences. So they're different, Mrs. Thompson. So you're going to have to pay up, pay the difference, $3,000. And that modifier 59 says you got to pay more, 50 says you got to pay more, and 51 does too. You got to pay more, but not as much. So you had multiple procedures or multiple paint staining um, you know, instances, and you have to be the worker has to be compensated. So remember this. And somebody said this helps. Use modifier 51 unless it's bilateral or different. Okay. Now here's our agenda for today. Look, it's we got 12 minutes, but we're going to drive this home. All right. So today we've got last time we've discussed modifiers 22, 52, and 53. And this time we have modifiers 50, 51, and 59. So we're going to just kind of finish things up. If this is your first time here, again, the inside cover of your CPT manual, you'll find all of the abbreviated modifiers. And don't forget Appendix A. You can find your in-depth definitions. I encourage you to look up 59. Just kind of get some, get accustomed to that 59 because it's going to really, really help. Remember, it's 51 unless it's bilateral or different. You all ready? Okay. A surgeon performs a carpal tunnel release on both the right and left wrists during the same operative session. Which modifier should be appended to the CPT code? Okay, coders, put your answers in the chat. What say you? And someone says, hey, do we always use modifiers? You always use a modifier when you have multiple procedures, unless there's an entry like an add on code or something that would, you know, allow you or prohibit or allow you to not use a modifier. Good job, good job. Everyone's responded in the chat, and the answer is C, modifier 50. Keywords, carpal tunnel release, both right and left wrists. Very good. All right, so modifiers LT and RT, those are informational modifiers. They are not functional. Remember, I said functional have precedence or, you know, they take precedence. That's a good example. So if you see LT or RT, that's not going to help the money. It's 50. All right, a physician performs bilateral myringotomy with tube placement on both ears during one operative session. Which modifier is most appropriate? A, 59, B, 51, C, 50, D, 22. What say you? Sorry, I read it out of sync. We have a storm going on over here. Remember, it's 51 unless it's bilateral or different. What say you? And the answer is good job. I see people self correcting. The answer is, well, it's bilateral. So the answer is C. All right. So that's enough of bilateral, right? All right. Which modifier should be reported on the secondary procedure? A, 50, B, 51, C, 59, D, 52. We can eliminate something off bat, and I'll tell you later. During the same operative session, a surgeon performs an excision of a lipoma from the patient's shoulder and also repairs a laceration on the forearm. Okay, coders, is it A, B, C, or D? It's always 51 unless it's bilateral or different. Anything different? Good job. Good job. Good job. Okay. So my keywords had an excision of a lipoma on the shoulder and then repairs an arm laceration. Shoulder, arm, different body parts. That's a different procedure. Okay, coders, how you doing? You doing good? If you want to self-correct, you can. And I realize that we do have some I2MC students. You go ahead and put your answers in that chat. You are learning and we're going to help you. Okay? Good. Good, good, good. All right. Which modifier best describes the encounter? A, 59, 50, B, 50, C, 51, D, 53. A patient undergoes a diagnostic arthroscopy of the left knee, followed by a left meniscectomy during the same operative encounter. Now, this would require that you know what is a meniscectomy, or what is an arthroscopy. Well, we do know they're different procedures. We do know that. But are they related or normally carried out together? And that's important. So we had an arthroscopy and we had a meniscectomy. Well, why is that 53? It's 59. Sorry about that. Got to pull that up. Let me see if I can pull it up. Pull it up now. The answer is 59. Okay. I might not, it won't show here, but it's multiple, excuse me, this is 51. It's not 59, it's 51. I apologize. So it's multiple procedures, but they are related, right? So when they're related or normally carried out together, it would be 51. I do apologize. Come on, let's go back. All right. So this is 51 because it's multiple and it's related. An diagnostic arthroscopy of the left knee, that's a diagnostic procedure. Then in that same scope, they carried out a meniscectomy in the same scope. All right. So it might have been different procedures, but they were related and commonly carried out at the same time. So it is a multiple related procedure. Now, for those of you that are advanced, I want you to watch separate procedures. You know what I'm talking about. Okay. But if there's no separate procedure documented, this is 51 modifier. Okay. All right. Which modifier best describes the encounter? A, 50, B, 51, C, 59, D, 22. A physician removes a lesion from the patient's right arm and left arm. The procedures are normally bundled, but were performed at separate anatomical sites. He is giving you the answer. Okay, chat. He gave you a little hint. All right. So a patient had A lesion from the right arm, a lesion from the left arm. It is C. Different lesions, anytime it's a different lesion, use modifier 59. Now I'm going back. I need to go back into Appendix A and let's look at where I'm getting this from. In when in the writing it says when you have a separate lesion, it is modifier 59. Anytime you have a separate lesion, you will append modifier 59. Okay. And yeah, somebody said, hey, 50, that's a good, even if it's on opposite sides of the body. No, this 59 says separate lesion. It further specifies that you use 59 for lesions. And the reason is because these lesions are so small and the payout is really small too. So the doctor can get compensated adequately for those lesions. Okay. So that is specifically mentioned, lesions. If it's separate, then you give it a 59, not 50. All right. Which modifier would be appended to the knee arthroscopy code? Is it going to be A, 50, B, 51, C, 59, or D, RT, LT, right and left? A surgeon performs a bilateral knee arthroscopy and repairs the laceration on the left leg during the same operative session. Which modifier will be appended to the arthroscopy? He carried out a bilateral arthroscopy, right? And a laceration on the left leg. And I know I'm going at a fast pace. I do know that. And we do have multiple learners here. And I want to assure you that you can watch this playback. But the bilateral arthroscopy is what we're coding for because that last sentence asks us what modifier will be appended to that arthroscopy. And if it's bilateral, it would be modifier 50. And also make sure you pay attention to the question too. I know it can be like, confusing, but trust me, if you keep doing these, it's going to make sense. It's going to make sense if you keep doing it, right? Of the following answers, which best describes the encounter? A, 11402, 1120051 modifier. B, 11402 50 modifier, 11200. C, 11402, 1120059 modifier. D, 11402, 1120052 modifier. A 55-year-old patient presents with a sebaceous cyst on the upper back and a skin tag on the right axilla. During the same encounter, the physician excises the cysts and removes the skin tag. Both procedures are completed without complications. What say you? I see you. DC said, hey, I'm confident. Boom. All right, Mojena. Mojerena. Okay, Patty, I see you. Okay, Goodwill, I see you. Francois, too. Shanta, you know what? I think you got it. I do. I do. And here are my modifier focused keywords. Number one, he excised that cyst of the upper back. He removed the skin tag of the right axilla, right? So sometimes excision and removal can mean the same thing, and sometimes they can't. Removal could mean um, frozen, or laser, right? So we paying attention to those keywords. And you know what? These are two different procedures, two locations on the body. So you know what? they're different. These procedures are different indeed. And they are not carried out at the same time. And what do you mean by that? And I don't mean to say no, but these procedures are different because they are not carried out at the same time. So, what do you mean by that, Mrs. J? Well, you don't normally carry out an excision of the cyst of upper back and removal of a skin tag axilla. Like, that's not normal. Most people don't have them at the same time. So they are not normally reported together. But they are appropriate under the circumstances. You know what? They're appropriate to be carried out at the circumstances, but they are not normally reported together. So therefore, this 59 modifier is applicable. And that's why it's modifier 59. And also, to further clarification, they're not ordinarily encountered or performed on the same day by the same individual. No, possibly a derm could do it, a regular, PCP could do it. So, yeah, different. 59 modifier. All right, we're getting down to the wire. Of the following answers, which best describes the encounter? A, 1006059 modifier. B, 9921325 modifier. That's evaluation and management, if you didn't know, coders. 10060. C, 9921359 modifier, and 10063. And D, 99213 and 1006025 modifier. An evaluation and management means that's a doctor visit. A 30-year-old established patient presents to the physician's office complaining of a painful abscess on the right thigh. The physician performs and documents a medically necessary problem focused history examination and medical decision making to evaluate the abscess and determines treatment options. After the evaluation is completed, the physician performs an incision and drainage of the abscess. Okay, coders, this might be a little different or challenging for some, especially if you're new. Okay. Okay. Yeah, it only could be one answer. So, you know, for those of you, okay, I'm going to explain this to you. And some of you might get this. So we did have a doctor visit, an E&M visit. And he also determined that, hey, I need to do an IND of that abscess, right? So let's just look at these answers. And when you become more seasoned and fluid with these modifiers, this is a circumstance where you can eliminate or answer this without even reading this scenario. Why? Because modifier 59 is only used for multiple procedures, right? Right. We only had one. So we can eliminate A and we can eliminate C. And also, I'm going to let that marinate. Multiple procedures, modifiers are only used on multiple procedures. So we only had one procedure. And just so you know, modifiers 59 and 51 are appended to the second or subsequent procedures. Not only did we not have multiple procedures, you never append modifier 59 on that initial procedure, right? So A's wrong, And so too is C. C's wrong because the visit is not a procedure. That's a visit, a doctor visit. You're wrong. Now let's look at B and D. B is a appending 25 modifier, which is, significant and separately identifiable service on the E&M code. And D is putting it on the surgery code. Well, if you remember the guideline says, hey, you don't really put, well, I guess the guideline didn't really say it, but you can kind of guess. This modifier 25 is only to be used on E&M codes, not multiple surgery codes, right? So the answer is B. And there's no way you all would have known that, but I just wanted to put it there to see if you could kind of deduce. For those of you that were advanced, some of you could, that it is indeed B. And also want to let you know that when you become more fluid with your guidelines and you know those guideline nuances, you're going to be able to answer this without reading it. And that's the only time I suggest that you do it because you know what you're doing. You know the code structure is incorrect, not because you're doing some kind of trick. No, right? So remember, evaluation and management modifier 25 only belongs on modifier on evaluation and management codes. So if it's ever on a non E&M code, then it's wrong. All right. So where is that? This 59, they talk about E&M, but these are not E&M codes are not procedure codes, right? They're visit codes. So I think, our time is up. I knew we were going to go over, and I was in a little storm. Not little, I was in a storm, but we made it through. And there are some final things that I want you to remember. Number one, your modifier 50. We know what modifier 50 is, bilateral. And you only use one code and the modifier to describe both procedures. Just kind of get that in your space. Just kind of just think about that. It's only needed on one code to describe both procedures. Now, modifiers 51 and 50, 51 and 50 may not be appended to an add-on code. You cannot append these to, that's like a standard rule. If you see it in an answer, it's wrong. 51 and 50 may not be appended to an add-on code. And finally, remember, it's 51 until it's bilateral or different. And if you want to know if it's different, read Appendix A. Different site, different structure, different lesion. Something's got to be different about it unless it's normally carried out together. Now, if it's normally carried out together, then it's not different. All right, so coders, you are now on your way. We've discussed we've discussed multiple procedures. Last week, we talked about altered services. And we also talked about E&M a little bit. We got a little more to go, but these modifiers give you more to the story. And this is the AMCI cheat sheet. If you want it, let me know. But AMCI, MCDC students, you all have more than enough. You have a sheet, and I am going to put this in your course, but if you have to have it, let me know. It is in your book too, so let me know. Too much might be too much. AMCI, MCDC students, don't forget to utilize your Lucene. This is our AMCI um, generated, this is our AI coach. So not only do they have us 24 hours a day, 7 days a week in Lucene. So go ahead and check it out. And just want you to know that this week we talked about more than one procedure happen 50, 51, 59. Next week we're going to talk about these stage or related procedures 58, 78, and 79. All right, so some of you asked about playbacks. You can find them on our YouTube channel. Just click on the live button up at the top. Click on the live, and you'll see the classes there, and it's going to have this image. All right, and then there you go. And also, don't forget to like this if you're on YouTube, and I think all of you are on YouTube. Don't forget to like this live. Like it up. Thank you in advance. And also, we have a survey. It's very short, and these surveys help me help you. They do. So if there's something specific that you want to talk about, or there's something that I wasn't clear about, let me know. And yes, every week I'm challenging myself to really refine how you get it. Like I want to make sure that I reach everyone. Yes. So I want to thank you all. I want to thank my team, Mr. Sandeep, Ms. Mills, Miss Haley, Ms. Beth, Miss Vina D. Let's see who else is in here. I hope I didn't miss anyone. And thank you all. Katie did, Goodwill, Anna, Patty, Juanita, Mojen. Sorry about that. Miss Tavers, Shanta, Deborah, DC Kick, Walaka, and more. You know, I'll sit here all day and say all your names, and we've already extended the time. And I thank you so much for staying with us. And, we'll see you next week. Yeah. And thank you all for coming. Hi, hi, Case. All right, everyone.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all